You might wonder what impact fasting has on your blood pressure. Can fasting reduce your blood pressure? Is it dangerous in certain situations? Watch till the end. You'll be surprised how intermittent fasting can affect your blood pressure. According to World Health Organization, about 1.28 billion adults from age 30 to 79 have high blood pressure, and about 46% of people are unaware that they have this condition. Are you one of them? The sad truth is that the numbers are expected to increase by 2025. High blood pressure, also known as hypertension, occurs when the force of blood flowing through your arteries is consistently high. This causes your heart to work too hard to pump blood through your body and may eventually cause cardiovascular disease, including stroke and heart attack. According to the American Heart Association, high blood pressure is diagnosed when readings are consistently at 130/80 mmHg or above. We know that high blood pressure might sound frightening, but you can manage it by including intermittent fasting in your lifestyle. Dr. Dennis Brumer from the Cleveland Clinic says that fasting can help lower blood pressure, reduce cholesterol, control diabetes, and reduce weight. He points out that you can reduce your heart disease risk by targeting these 4 areas through fasting. Furthermore, having longer time periods when we don't eat helps our bodies perform their best. Excessive weight and obesity are connected with high blood pressure and heart disease. So fasting not only benefits in losing weight, but also lowering your blood pressure. If you're still doubting if intermittent fasting can be that beneficial for managing your blood pressure, let's see what research has to say about it. We'll also give you 4 essential tips on how to do intermittent fasting safely for the best results. So keep watching. The journal Cell Metabolism published a 2020 study which shows that intermittent fasting helped women with metabolic syndrome. It's the medical term for a combination of diabetes, high blood pressure, and obesity. For 12 weeks, the selected women only ate within a 10-hour window during the day. The study results show that intermittent fasting led to weight loss, lower blood pressure, and reduced cholesterol. Another study, including 32 adults, found that those who followed alternate day fasting decreased their blood pressure compared to non-fasters. They ate 400 to 600 calories on their fasting day, and whatever they desired on the other days. And that's not it. In 2018, Nutrition and Aging published another study involving 23 adults on a 16-8 fasting regimen that found similar results and significantly lowered blood pressure. These are just a few studies that prove the positive outcomes of fasting for managing hypertension. Tons of studies support the notion that there is an association between fasting and reduced blood pressure. One word of caution though, Dr. Dennis Brumer notes that fasting can lead to an electrolyte imbalance. This can make the heart unstable and prone to arrhythmias. So, if you already have high blood pressure or have a risk of hypertension, talk to your doctor. You'll need medical supervision. Most likely, you'll have to check your blood every month, and the doctor will prescribe potassium supplementation to prevent electrolyte imbalance. Also, you need to know some key factors for effective yet safe fasting. So, we're giving you 4 essential tips on how to do intermittent fasting safely for better blood pressure. Tip number 1. Start planning your meals. When you fast, you may end up eating less food overall, so make each bite count. You shouldn't consume less than 1,200 calories a day. If you eat fewer calories than recommended, you'll end up binge eating. To avoid that, start to plan your main meals in advance. Remember, fasting only works if you make wise food choices during your eating window. Meal planning makes this process easier. Tip number 2. Eat more of these foods. Food can have a noticeable impact on your blood pressure. Consuming healthy fats such as avocado, olive, or coconut oil, nuts, and fatty fish like salmon can all reduce your heart disease risk. We recommend including at least 1 or 2 of these foods daily. Also, you should include fiber-rich foods in your diet. If you eat 30 grams or more of fiber per day, it can reduce your heart disease risk and diabetes. Optimize your nutritional intake during your eating window by choosing more whole grains like oatmeal, quinoa, lentils, chickpeas, kidney beans, seeds, fruit, and vegetables. Tip number 3. Get enough minerals. There are 3 main minerals that help lower your blood pressure. It's magnesium, potassium, and calcium. Magnesium and potassium help relax your blood vessels, lowering the pressure, while calcium helps your blood vessels tighten and relax when necessary. Here's the list of foods that are rich in minerals. Remember, you have to focus on eating more of these foods before jumping into using supplements. Tip number 4. Lower your salt intake. Salt contains sodium, a mineral that helps your body maintain fluid balance. However, when you eat too much sodium, your body will hold on to more water, putting more pressure on your arteries and heart. If you reduce your sodium intake, it can help reduce blood pressure and even the risk of other heart diseases. It's not necessary to cut out salt completely because you need it for fluid balance. Try reducing processed and unhealthy snacks. It will significantly reduce your sodium intake automatically. Eat more homemade, whole food-based meals instead. Find out more about intermittent fasting by checking out our playlist, Intermittent Fasting, the ultimate guide. Also, watch the successful weight loss story, where Sarah shares how she lost 44 pounds by doing intermittent fasting.